Welcome to What the Health, an independent approach to your health span. Have you noticed how our healthcare system may not have your best interest in mind? Join Dr. Eckel in this fun and sometimes disturbing exploration of the state of healthcare and what it means for you. Now, here's your host, Dr. Eckel.
All right, welcome back, everybody, to What the Health. And I am Dr. Greg Eckel, and my esteemed colleague and guest and lecturer and author and mystery man extraordinaire, Dr. Alan Christianson, is on the show today. And I actually do want to give Dr. Christianson a proper intro on the accolades and credentials of this man. He's board certified naturopathic endocrinologist who focuses on thyroid care. He's a New York Times bestselling author whose recent title includes the Thyroid Reset Diet, which we've got right here in the show, in the house with us. He's been featured on countless media appearances, including Dr. Oz, The Doctors, The Today Show, now What the Health. He's the founding president behind the Endocrine Association of Naturopathic Physicians and the American College of Thyroidology. Our topic today is reversing thyroid disease. Welcome aboard, Dr. Christianson.
My friend Greg, good to be with you, man.
Indeed. So good to have you on here. And I'm really excited to, help get the word out on, I've got it at an angle. There we go. The Thyroid Reset Diet. Beautiful edition here with some really amazing information and new information for folks. I mean, thyroid disorders have been around, with my focus in the brain health realm. I'm looking forward to touching in on that as well. But it seems like we hear more about thyroid disease. Is it more common than it used to be?
It sure is. So there's pretty hard numbers on thyroid cancer, and they've tripled over the last couple of decades. Huh. There's pretty good numbers on rates of diagnosis and rates of treatment for chronic adult thyroid disease, like hypothyroidism and Hashimoto's. They've basically also doubled and tripled over the last several decades. So it's really, really clearly on the rise.
Any particular reasons or correlations, causations? What are you seeing out there?
That's the thing. A lot of research is trying to answer that question. What is the cause of this? And one quote that came out recently, a researcher said that there are many causes, and iodine being one of them. All the other known causes together are not as relevant as iodine is by itself.
And this is a big piece that you've written about in the Thyroid Reset. Was that surprising to find?
It was surprising in stages. Yeah, there was a lot of various levels of surprise along the way with that. Yeah, definitely.
Yeah.
I've known forever that your thyroid needs iodine, and I've known for quite a while that too much can be harmful. But the surprises are that some people just don't tolerate even the slightest excess. And then the other big surprise was that with a deliberate reduction, the disease could often reverse. So those are the two biggest things that surprised me.
Wow. We read about, we've got iodine in the salt, right? We've got iodized salt that happened in the 30s, I believe. And really, what you're showing is there's that sweet spot of it. Do you have a way of measuring it, or is it really around the regulation through the diet therapy that you put together?
Well, so yeah, the fortification you mentioned, you're pretty much spot on. It was 24 when we first did that, and Denmark did it in 2000. There was just a paper that came out a few weeks ago looking at 20 years now after Denmark fortified. I'd seen a lot of papers for their first 15, 16 years. Now we've got a 20-year compilation. And yet each year afterward, they saw average annual increases of about 50% for chronic adult thyroid disease. And how do we know what's best? Well, you can look at various graphs and charts, but the hardest data comes in from studying populations and seeing just how much thyroid disease they get and how much iodine they ingest. And the World Health Organization has been doing that for pretty thoroughly for the last 60 years, and they've compiled tens of thousands of data points. And it seems that the window of about 50 to 200 micrograms per day from all sources is where we see the lowest amount of onset of thyroid disease.
What are some foods that have high concentrations of iodine?
So there's some, I'll answer this in two ways. There's some that have always had some, and there's some foods that now have a lot more. So the first category, foods that have always had some, seafood, sea vegetables, kelp, iodized salt, pretty stable, pretty consistent. Egg yolks, some there. Now, a good point is that pretty much all foods have some iodine. There's almost nothing that has none. So fruits, vegetables, nuts, and seeds, not a lot in many of those, but pretty consistent, stable amounts. So what's recent, though, there's been iodine as a contaminant and iodine as an agent of food processing. And that's mostly going to be processed grain products and then dairy foods. And those two, they comprise 23 of the top 25 dietary sources of iodine. And the amount of iodine they give us has doubled or tripled over these last couple of decades. So yes, there's been a stable amount in those first few foods. Then these last couple have just gone through the roof. And the total amount together is what affects us.
Got it. So that has actually been increasing in our diets.
Yeah.
When did iodine become, it kind of was a fad for a bit in the alternative health world, right? Of like, oh, we're lacking iodine. We need more iodine. And I still see patients today that are taking copious amounts of like seaweed capsules and along these lines. Where did that start?
Well, honestly, a gentleman who's since passed away, I spoke to him quite a bit, dear man, well-intended, and he speculated that we needed about 400 times more iodine than anyone before thought. And the tough part is that a lot of what he said seemed to make sense. It seemed logical. We think about the body needing nutrients, and it seems logical to think that if you need a nutrient for your thyroid to work, if your thyroid's not working, you must need more of that nutrient. It just seems so simple.
Yeah.
But yeah, a lot of things in the body have so many checks and balances that they often just defy our common sense.
I like how in the book you say, look, iodine is not the villain. We do need it. It is essential, but we don't need too much and we don't need too little. We need it just right in the Goldilocks principle. So I really appreciate that level-headedness that you approach this, but it's kind of a controversial component of the book, right? I mean, you mentioned kind of beforehand, like, it's actually been well received. There was less controversy than anticipated. It's around this topic, right?
It is. And honestly, it's all because of that idea that perhaps we need mega doses. And that's like the first pass approximation. It seems to make sense. But what happens is that this is the only nutrient that we concentrate. And so many things are completely different. It's also the only nutrient that just has one biochemical role in one organ. That's totally different. But because we concentrate it, a tiny bit of too much is kind of like too little. Once we get too much, we shut off the pump, and now all of a sudden our thyroid gets none. So paradoxically, more iodine equals less iodine.
Got it. Well, and what are the disease processes that we're seeing with iodine?
Yeah, so pretty much all versions of thyroid disease in adults, goiter, nodules, thyroid cancer, autoimmune thyroid disease, subclinical hypothyroidism, Graves' disease, Hashimoto's, they all have some relationship to iodine status. And now we're really talking about getting too much. We all require a certain amount, and our requirements are pretty predictable based upon our body weight. Age, gender, genetics, just body weight predicts that pretty well. But our tolerance differs a lot from person to person. So how much extra can we get away with?
Interesting. So body weight, if you were a heavier set person, maybe with obesity, you potentially are tolerating more iodine because of that? Or what's that ratio?
You require just a little bit more because of your body size. Okay. And that doesn't change requirements to where you suddenly need massive amounts. It means you just might tolerate a few 10, 20 extra micrograms. But tolerance differs greatly from person to person. So some people can get some extra iodine in their system, and it's like water off a duck's back. No big deal. They're not the ones who are going to go on to get thyroid disease. So those who don't tolerate those occasional excesses, those are the ones prone to thyroid disease.
Got it. And is that, so you're seeing, are you doing genetic markers on that? Or is it more just, in the clinical case component for you?
Yeah, there's a lot of examples to where we know that genes relate to various things, but we can't really differentiate the gene status from the gene expression.
Yeah.
1% of people have celiac disease, 60% of people have celiac genes, 60. And this is one of those scenarios. We know a lot of genes that relate to iodine tolerance, but for some people, they express differently. So really, it's just, if you've got thyroid disease, you don't tolerate extra iodine.
Right.
And I personally don't have thyroid disease, but I don't want that to change. So I still avoid the extra iodine.
Got it. Yeah. And is there a test that people can do on their iodine status, or are you looking more functionally at their thyroid panels? How do you assess?
That's a great question. That's been a source of a ton of confusion too. And this also defies logic. So iodine is in 3 main compartments. It's inside your thyroid, it's floating around in your blood, and then you pee it out. Those are the 3 big areas. Now, most of what we ingest ultimately gets peed out. So over long periods of time, and most importantly, in large numbers of people, urinary excretion does correlate to iodine status nutritionally. However, it requires large numbers of people, and you can only make inferences about the group. If you have fewer than 500 people, your data falls apart. And if you have one person, you honestly need to test them over 300 to 400 times to be even in the ballpark. So yeah, for one person, there's just no relationship between urinary iodine and iodine status. Now, in the blood, iodine is kept in a pretty narrow range until you get toxic. So we've got too little, enough, excess, and then we've got toxic. So toxic means your kidneys can't clear it anymore and they get damaged from the extra iodine. That's not that common, but it's only when that happens that iodine starts to elevate in the blood. So serum tests are good gauges to see if someone's at a toxic level. That pretty much only comes up for those who have taken amiodarone, a cardiac medication in the prior months. That's about the only context in which serum iodine is useful. Because it's so buffered, there's no relationship between your nutritional status of iodine and the iodine in your bloodstream.
Got it.
There are some tests that are pretty good, but they all fall apart in those who have thyroid disease.
Sure.
So thyroglobulin, not the antibodies, but thyroglobulin, and also thyroid volume are inversely related to iodine status, unless you've got thyroid disease. So they're not helpful. And then last thing is there's the skin test for iodine.
Yeah.
And yeah, you put iodine in your skin, it does disappear, but the disappearing is not absorbing. The disappearing is oxidizing into the air. And we do absorb some, but there are mechanisms by which our gut can absorb more or less of a nutrient based upon what we need, but there's no mechanism by which our skin absorb more or less based on what we need. So that one falls apart.
Got it.
We've got no great tests.
Yeah, that one kind of more, health food store, kind of put the iodine on and see, well, how quickly does it go away, right?
Sure.
And so thanks for bringing some clarity around that one. So on, a lot of folks, so we're seeing preponderance thyroid issues coming up. It's a small gland on the throat. The iodine, I want to make sure like our listeners to What the Health understand how does iodine play a role with the thyroid? Because people may not know that. Yeah.
It's a fascinating link between the development of life on Earth and iodine. It's a very powerful compound for carrying free radicals. And it was just essential to photosynthesis, to energy production, to all things in development of life. And as life got complicated, and we moved away from the ocean, we needed ways to carry, store, and manage iodine for those purposes. And that's really why the thyroid gland evolved. It's really just a way to distribute iodine so we can use that for chemical reactions. So thyroid hormones are a protein with iodine attached to it. And if we go way, way, way back, we just got it by floating in the ocean water, and there it was. But as we got more multicellular, more complicated out of the oceans, we had to carry and store it and dose it out. And that's what the thyroid gland is for.
Perfect. And, those measurements in the blood, right? T4 and T3, the storage form, there's 4 iodines and 3 iodines.
Yep.
So we'll see patients oftentimes, they've been diagnosed with hypothyroidism for 3 decades. Is this something that can reverse? Once you get a thyroid disorder, do you always have a thyroid disorder?
Yeah, good question. So reversing, I always think about 2 facets of that. One of which is There's those to whom they no longer need medication. They feel fine. They've got stable function. Those types of reversals are possible for some. The other type is how your body responds to thyroid hormones. You practice for a long time and you've seen this. There's tons of folks to where they're not making enough. Maybe they don't even have a thyroid, and they're taking what they should need, yet they don't feel like it. They're still symptomatic in a lot of ways. So part of the problem is that the thyroid doesn't make hormone, but the other part of the problem is the body quits responding to hormone. So this iodine thing can help with both parts of that. In those who still make some hormone by themselves, and they've had disease for 6 years or fewer, a few more variables, there's a really high chance they can make more by themselves or all of it by themselves. Yeah, some people lack a thyroid, and I used to say that'll never change, but I've actually seen people who had their thyroid removed. It wasn't all removed, they regrew some and actually didn't need treatment longer term. So now that's not common.
Yeah.
But never say never, right?
Sure.
So yeah, there are those where they will likely still need treatment longer term, but they can do things to help them feel a lot better from their treatment.
Got it. And is there any consequences for long-term treatment?
Long-term treatment with thyroid medication?
With let's say in hypothyroidism and taking thyroid replacement.
Yeah, that's a good question. So the medication inserts will say things like risks for bone disease, risks for heart disease, and those are possible, but they're really dose related. If someone is taking a dose that puts them at an appropriate range, they're not more at risk than someone whose body makes their own. So yeah, with appropriate levels of treatment, really no risks. Not everyone feels their best, and there are a lot of ways to help that work better, but done properly, they are safe and they do replace what the body would produce.
And with, because a lot of patients do ask that the opinion is like, if you need thyroid, you should take thyroid because it is very essential for our life and our metabolism. Yeah. Are there other hormones that interplay with the thyroid that you look at? Because this is not just a standalone hormone for folks.
Yeah, for sure. They really all do. You bring up a good point. All hormones do interact with one another. Some ways are dramatic and predictable. A big example would be estrogen. So if a woman goes into menopause and she's on thyroid treatment, she's likely going to need less. Estrogen has a persistent blocking effect against thyroid. Or if a woman starts hormone replacement, she'll probably need more thyroid treatment. So there's predictable changes in those ways. Then we also think about things like cortisol cycles. So if the cortisol cycle is not with a good morning elevation and nighttime shutoff, that will make the body less able to absorb thyroid hormones across the cell membranes. And then that also vice versa. If the thyroid levels are very abnormal, the body may intentionally alter cortisol rhythms to keep them out. So yeah, they certainly do interact. And I hear that it's something good to be aware of by the doctors, but one can still safely take steps to help whatever's wrong, and things won't get made worse elsewhere by doing so.
Yeah. With, so predominantly when obviously you being kind of the thyroid expert in North America here with, your previous book, Adrenal Reset, you got the Thyroid Reset. So this is predominantly written, this is for all things thyroid, but, clinically we see, I see just in a general practice, more hypothyroidism, subclinical hypothyroid or autoimmune thyroiditis. But obviously this is going to be beneficial for any thyroid disorder.
Well, so you hit the big three exactly. Chronic hyperthyroidism from Graves. We know it can be a helpful adjunct for people with that as well. There is data saying that excess iodine can be a driver for precipitating thyroid cancer. There's no data saying that controlling it after the fact makes a difference. So I just can't, I don't know that. Toxic nodules, another source of hyperthyroidism. No data saying iodine can trigger it, but it may not change it after the fact. But definitely what you said, hypothyroidism, subclinical, Hashimoto's, and then some secondary benefit for Graves' disease.
Got it. And in particular, in the hypothyroid camp there, are you all seeing more preponderance of the autoimmune component to hypothyroidism? And I ask this because, I will see, and here in Portland, Oregon, where my clinic is, I'll see, the patients that come in from the top-notch endocrinologist, but they aren't getting adequate testing. And the treatment is the same in conventional land, which is, oh, you're hypothyroid. It doesn't matter that it's an autoimmune condition. You're going to be put on thyroid. So their thought process is, it doesn't matter if it's autoimmune or just hypothyroidism, you're going to get the same treatment. So we don't really need to know. I'm guessing you see very similar down in Arizona.
For sure. Yeah. So a lot of great points you bring up. One thing that's often surprising is that autoimmune thyroid disease often never has measurable antibodies. So half or more people that have autoimmune thyroid disease never have positive TPO or positive antithyroglobulin. So many people think they don't have autoimmune disease when they still do. The antibodies don't rule that out. Now, the other factor you bring up is that the autoimmunity is important. So there's been a lot of data looking at those who do clearly have autoimmunity and do have elevated antibodies. And let's say that they're on treatment, their thyroid levels are normalized. Well, it turns out the antibodies, even after that fact, can still predict cardiovascular disease, infertility, cognitive symptoms, chronic pain symptoms, hair loss. So yeah, the autoimmune part is important as well. And that's relevant to people's well-being.
In the book, do you have, because I noticed you did talk about, you've got your diet therapy plan on the low iodine component and other aspects, but you also mentioned like, well, what about vegans? You get asked all the questions. What about the autoimmune protocol? These other diet therapies that have already been out there, value of using them versus not. What have you found clinically down there? What's obviously this is getting the results. That's why you put it in book form for us.
Yeah. For so many years, I would see people say, hey, I went gluten-free, I went autoimmune, I went vegan, and my thyroid got better. I hear a lot of folks say, I went gluten-free, I went autoimmune, I went paleo or vegan. My thyroid didn't get better. I'd see hit or miss,
right.
Sometimes benefits. And I'd look at the studies, and there's been one big published study on AIP looking at thyroid markers. They didn't change, So I see the data is hit or miss in the research. And I was always kind of stymied as to why these things would sometimes work, not always work. I couldn't find good reasons why they would work. And as I was putting this book together, I realized all those diets, they lower iodine, So someone can make those choices for a lot of reasons besides just this one. And if someone already is doing autoimmune or vegan or something, totally cool. You can easily work within this. Yeah. But other people say, hey, I'm just trying to help my thyroid and I'm trying all these diets. This might be the one part of it that was most relevant. And so if you focus on this facet of it, you can get the benefits and still have a broader variety of natural food options.
Lovely. All right. So you had mentioned some of the symptoms on the brain health. So let's talk about thyroid's relationship to brain health here for folks. In particular, Parkinson's is near and dear to me, looking at, there are PubMed research studies showing hypothyroidism can mimic Parkinsonism, and correcting the thyroid actually can improve the symptoms of that. What are you seeing? How do you tie in the thyroid discussion with brain health for folks?
That's an awesome question. So some things that are different about thyroid hormones from other hormones. Hormones work like keys and they fit into special locks. We call those receptors. And most other hormones have receptors in some parts of the body, but not all. Like we've got estrogen receptors in the breast, but not in the pancreas, for example. But thyroid receptors are everywhere, and there's different ones. There's different types of thyroid receptors. The part of the body with the greatest density and the greatest diversity of thyroid receptors is the brain. So we need them there. Even things like reverse T3 are completely essential for brain function. They all have to be there. There's an old term, a cretin, kind of like an old way of saying like a dummy or an idiot. Well, medically, those were people that were born with severe hypothyroidism. And they never developed a normal brain. They couldn't function cognitively, and they even look different. They look kind of like Neanderthals. And in the early 1900s, there was a few pockets up in the Alps, some remote areas where there was villages of cretins. So yeah, without good thyroid function, your brain cannot develop. And even then, once you do have your brain develop into adulthood, changes in thyroid function can cause marked symptoms in brain fog, memory, risk for various diseases, Parkinson's, Alzheimer's, and then also vascular problems that affect the brain and its function. And it's also exactingly narrow. The brain needs this precise balance and precise proportion of thyroid hormones to work well.
And is there a way of looking at that? Now, I know we kind of brought up the genetics, and you were so graciously just kind of shuffled that one off to the side of, and giving of the example of celiacs, right? There's, 1% of people experiencing the symptoms, but 50% of the population, has the gene. So they're not always, just because you have the gene doesn't mean that it's active or not working. On the conversion, I've seen some interesting data around, T4 to T3 conversion in the brain, around brain fog, like where you actually see a real world change for folks and showing some genetic potential platforms that people are on where maybe you want to tune into it a little bit more. Are you playing with that at all, or waiting for more data to come in?
No, I've written about that. It's totally valid. I've seen some studies, and per subgroup, per ethnicity, the genetic variations of someone, specifically they're looking at how well someone can respond to T4 only therapy and how likely they are to have symptom control and then serum T3 levels. The funny thing is that serum T3 levels don't always predict T3 utilization within the cells. So there are many cases in which someone can be symptomatic even if their T3 is normal or high normal. So yeah, and per ethnicity, per group subtype, in some cases, those genetic variations are 80% of the population.
Wow.
So yeah, and the funny thing is that the people that seek out someone like yourself or someone like me, they're by and large not satisfied with T4 therapy. So just by default,
our bias,
not doing great. So I guess I don't feel a need to dig too hard to say, should we change you in some way?
Right. And it is our selective bias, right? I kind of like, well, conventionally they're making our practices because it's not working for the mass. And so on that level, like looking at peripheral conversion of T3, is there validity for temperature charting or regulation throughout the day? Do you see any correlation between kind of peripheral conversion of T3 rather than just looking on lab values?
Yeah, lots of tools are out, and many practitioners can use various tools and pair that with their clinical acumen to help guide things along the way. I've not used temperature or Achilles reflex. I don't even put a lot of weight on serum levels of free hormones, in all honesty.
Sure.
Really, I think a lot about it from my focus of just getting TSH to a particular target for a person and watching their symptoms respond. So I really work hard to dial in iodine, get their levels, what's optimal for them. And then when symptoms are not responding past that point, there's a whole lot of other conditions people with thyroid disease are prone to that are often undiagnosed. So I often see that's like the big thing. People that have normal thyroid function, they don't have perfect thyroid levels. They fluctuate. They've got a certain amount of variation. So when someone is healthy, they don't have to have this exact score all the time to function. They've got leeway. So I think less these days about trying to manipulate exact correct levels and more about helping people to get healthy so they can tolerate more normal fluctuations.
Sure. Really. So, wow, go figure. Like how is their life in the real world versus the labs? That's very refreshing. We see so many integrative practitioners treating labs and lab values and really missing the boat of the human being sitting in front of them. So that said, what do you see as the biggest pitfalls of maybe folks walking around? They've seen, multiple practitioners, and they kind of miss the boat on, hey, this is a thyroid issue for you. What's kind of a presenting factor into the clinic there?
Yeah, well, I guess another thing about the biases of my population, for like 25 years, I've treated 98% of people that have thyroid disease. So I don't see hardly anyone that's not been diagnosed.
Right.
So they exist. I know they do. But they're past that point before they get to see me. So it's not something I have a lot of experience with.
Yeah, got it. So it is maybe self-select bias because you do write extensively. You speak, you've got the book.
And if I were to see someone with most any symptom, I'd be thinking about their thyroid. Even if that wasn't the problem, I'd think about that and screen it.
Yeah, because you see it improve from really starting. You're like in the thyroid camp, right?
Right.
In Chinese medicine, I come from the spleen and stomach camp. We got Dr. Alan is coming from the thyroid camp, from that lens. And it is kind of a fractal discussion on, whatever level you're going to start with the individual. If you improve that gland, you're going to improve the other systems, right?
Yeah.
And so you've got that as the central core, which is really fascinating and a great approach. So I guess symptomatically, I'm going to ask you that question again. So we're going to come back around and look at it on, so in your clinic, it's really whatever they're coming in with. Obviously, we're tuning the thyroid gland. What are the preponderance? Maybe let me ask it this way. What are the missed symptoms of when people don't think it's a thyroid issue, but there's these symptoms that are coming in where you're like, that's thyroid, where other practitioners had no clue?
Well, here's an answer, and here's also a secondary discussion with some more depth that's relevant. So big symptoms, fatigue, difficult weight loss, easy weight regain, poor memory, described as brain fog, depression, anxiety. We'll also see hair thinning, unexplained, chronic pain patterns. So part of it is, optimizing the thyroid. But then I mentioned the other conditions. So there's a lot of other conditions that are missed that are there as well. In many cases, someone beforehand has thought about their thyroid and attempted thyroid treatment. Sometimes it's helped, sometimes it's not. One huge thing, for example, is atrophic gastritis. So of those with thyroid disease, 30 to 40% have an autoimmune disease that renders them unable to absorb many nutrients and raises their risk for stomach and esophageal cancer a third of the time, and almost never diagnosed. That's just one of 15 common conditions that we see and think about.
Yeah. Awesome. That's exactly what I was looking for. Thanks.
Okay. one more big one just to throw in, parathyroid disease. So this is rather rare in the general population, not all that rare in those with thyroid disease. It distorts calcium uptake, and the big pitfall that makes it underdiagnosed is that people can have normal calcium. They will be on the high side, but they can still be in the normal range for calcium. And they can even be in the normal range for parathyroid hormone. But this is a huge source for many chronic symptoms of vague things like fatigue, depression, IBS, chronic pain patterns, mood disturbances. But huge source of severe symptoms that's often missed.
When do you have kind of a percentage around that, or ballparky?
Within those known to have thyroid disease, about 5 to 7%.
Wow.
And so if you realize that, you and I are seeing those of that group that already are self-selected for not doing well and having things fall through the cracks, it's going to be higher, but it's quite common.
Yeah. The parathyroid. And so that's a great clinical pearl for all of you providers out there and patients. If you're walking around like, hey, have you had parathyroid levels checked? Because that's a lab test, and it's not just based on calcium. A lot of providers will just measure that on if calcium, because that's a tight regulated ion. If it's out of the range, then that triggers the parathyroid testing.
Well, a little more depth. So calcium scores above 9.8 nanograms per mil are suspicious. And if calcium's even normal but high normal, parathyroid hormones should be low normal. They should be on a seesaw. If calcium is high normal and parathyroid is normal or high normal, that's not right. That by itself is a problem. The most blatantly obvious is when calcium's elevated and parathyroid is elevated. That's pretty obvious. But a lot of folks, it's not that obvious, but it's still real.
Got it. That's awesome. Great clinical pearl. Thanks for sharing that one. So the other component on, do you have any story around the brain health component? You mentioned brain fog, which is such a huge symptom in our society these days. Any patient stories come to mind as far as what you've seen with correcting thyroid and and that in particular for folks, because so many people struggle with brain fog. And, a lot of practitioners, kind of the flavor of the month right now is mitochondrial health. So they'll go and get their NAD IVs, or, they really boost the, red light therapy, and the mitochondria are all the rage. So what?
But why aren't they working right?
Right.
So no, on 2 days before we're speaking right now, I did one of my social media. I do it office hours live most Mondays. I just take questions, talk to people, and someone jumped on. People will often say things that happen from past visits or follow-ups. This was a woman who was institutionalized for non-specific senile dementia, and her daughter heard one of my talks discussing about the importance of thyroid function for brain health and cognitive health. And she had her mother evaluated and found out that she did have thyroid disease. She was on treatment. She was undertreated. They started the Thyroid Reset Diet with her, and her treatment wasn't yet changed, but now it was working. And she basically had 95% normal cognitive function within the course of several weeks. Wow. And she was brought back out and able to live at home with her daughter again. And her daughter was there telling me the story about this event. So there's a lot of cases like that to where, yeah.
That's a huge win, because, cognitive decline is definitely on the rise, and folks kind of just get pigeonholed over into dementia, Alzheimer's, and not looking at this facet of the care in hormonal regulation, and in particular the thyroid.
And I've got to jump in and say, or the other, this is what I'm talking about is one little piece of that puzzle. You're talking about the pieces. And so just kudos for the work that you're doing and help people make aware of all the many causes that can be missed and, give rise to these things. Things happen for a reason. And in so many cases, you can find those reasons and help with them.
Yeah. Lovely. Thank you. What, coming down the tail end of the show, any pieces of the puzzle that you would love to share with our listeners and viewers of What the Health?
The thing that really lit me up and made me inspired to want to write this book was the clinical trials about disease reversal. So one was actually just done in 2020, and this one was tracking, the term is de-prescribing. So how often do people who are on thyroid medication, how often could they successfully stop that and no longer need it? And this trial did just the most basic overview of how to avoid extra iodine and had people just stop their pills and be monitored. And what they saw was that 40% of people stopped medication and had no with the most basic guidance.
Wow. 40%.
Yeah.
Wow. That's a huge number for de-prescribing on just focusing in on what you've written in your book.
And there's a whole lot of other sources of iodine they didn't go into. So they really just went into some very basic high-level things to avoid.
Wow.
And a large number of people did well. An earlier trial took those that were not yet on treatment. They were badly hypothyroid. So Dr. Greg knows about this, but for everyone else, the TSH is a backward marker of thyroid function. So the higher it is, the more your thyroid is sluggish. And you're probably best off when it's close to 1 or 2, but it's abnormal when it's above 4.5. So in this study, the average score was 14, and many people were at 100 or 200. They were markedly hypothyroid. They did one thing only. They had them lower their iodine intake. The target was under 100 micrograms from all sources per day. And in 3 months, 78.3% of people perfectly normal thyroid function out of that group. So
with their TSH above, you said
no, wait, there's even more than that.
Wow.
So that was like about 80% of people. So the remaining 20%. So there's a couple categories of them. So I talked about the testing. There's a test called urinary iodine to creatinine ratio. It doesn't help to see whether or not your thyroid can improve with the diet, but if it didn't improve, it can help to see whether you need to spend more time on it or whether you got to dig deeper and find the other hidden sources of iodine. So they did that. So those that didn't improve, a large number of them hadn't found all the sources, or maybe they weren't complying with the recommendations. Tough to say. So you put them over here. You don't win. You can't win if you don't play, right? So they didn't win and they weren't playing. So the other groups, they weren't normal. They weren't yet normal, but they had average scores in the 100 to 200 range, and they came down by more than half in 3 months. So they weren't better, but they were heading that way.
Yeah.
And so of those who did play but didn't win and didn't even respond, they were about 3% of the population in the study. So darn near everyone got better or should have got better if they tried.
Yeah, get in the game, get off the bench, get in the game. That is so encouraging, actually. I mean, it gives me like chills to think about it. Like that's a huge win, and it's very encouraging and provides a lot of hope for folks. Like this is a big issue.
I read that study, and the next day it totally changed how I train my doctors and how we treat thyroid disease. Like this is like the first line approach for everyone, whether they're on treatment or not. This is the most important single thing.
Wow. And so that's what inspired the book. I mean, that is very inspirational. So thank you for sharing. And it is, we didn't have the data before. I guess it speaks into the science and the research and the continuing component. You'd think at this point on the planet, we'd have it figured out, but clearly not, right? I mean, that's a simple intervention that is discovered where 80% of the people really showed improvement. And the other 20% really, just needed to find the sources, right?
Yeah, they were getting better or they weren't trying.
Right. Or not trying. Go figure. That is phenomenal. All right. So into the last 5 minutes of the show, what is your favorite health advice for patients coming in or in your doctor's office hours? I've got all of your connection stuff in the show notes so people can reach out, find you. I do really want folks to go out and get the book because you've got recipes in here. You've got, I actually, from your previous book, I make some of the recipes from the Adrenal Reset. So I'm excited to have some more recipes here for my own family and use. And I know you guys test them. So actually, maybe you want to talk about how because you test all of these. And I know your wife is also involved with that. So actually share that process on these recipes. How are you coming up with them?
Boy, one of my first gigs was working in a restaurant, and my family and we just cooked together growing up. And I've always enjoyed that. And I've always had not always good ideas, but always weird ideas about what I should eat. I've followed a lot of fads, tried a lot of fads over the years. So I cooked myself pretty early along. And, having kids, when that happened, then I had to learn how to cook in ways where others would enjoy it also. Because I would just eat whatever, but I'd actually make it good then when I had the kids. So yeah, it's always been a big passion of ours to, cook at home. And actually, funny thing, last week we traveled and we had our first restaurant meal in a year and two weeks.
Wow.
And funny thing is afterwards we're like, nope, we're good to go for another year or two again. We're happy to
love it. Yes. You're doing something right when you're really enjoying what was coming out of your kitchen. So that's lovely. Yeah.
It's not hard. That's what I enjoy sharing in the book. It's not hard. You don't have to use weird ingredients. It doesn't take a long time and it can be really good. Yeah,
there's somehow in our culture, we got so far away from like, oh, I don't want to waste the time. And I thoroughly enjoy too. I mean, I grew up in Western Pennsylvania, like on canned beans and pot roast, and no offense to my mom. It was delicious, but I did not learn how to cook. And so to really engage with my kids, and it's such a great, everybody gathers in the kitchen, so to speak, and putting that time in together, one, exactly what's in your food. Two, it's really fun. Like everybody's participating in it. And so you're creating the meal together. Like that is it's a lost art, and it's so essential to our health.
And yeah, I love that you mentioned the myth about the time expenditure. So before I got on the call with you, I'll be eating supper with my family in a couple more hours. Before I got on the call, I took out some meat and sliced it and salted it and seasoned it and put that on the counter. I put a batch of rice in the rice cooker, and I stirred together several seasonings and some just base ingredients for a sauce, and chopped a few veggies. I guess that took me maybe 4 minutes altogether tops. And so after we're done, I'll spend maybe 5 minutes, heating it all up, searing it, throwing the sauce, and there's a meal. It's like 10, maybe 15 minutes, but you spend more time than that driving somewhere, waiting, ordering, waiting for your check, coming home. I mean,
the whole process. It's a great reminder. And, it is really important for us to get in tune with our food again. And I really appreciate that about your writing and your books, is that you've got meal plans in here. You've got a 28-week meal plan. So, you got the shopping list. You make it really easy, and it's straightforward. I like the size of the font even. I don't know that you've been appreciated on the size of the font, but yeah. It helps my middle-aged eyes, so thank you.
I'm right there with you on that. That's the reason why it's like that.
All right. Well, Dr. Alan, thank you so much. Any last parting words of wisdom, encouragement, inspiration?
I got into this journey like a lot of us because of my own health issues. And I've had so many times in which I was stuck in some way and I thought that it would not improve. And I've seen so many others in that spot too, only to find out they were wrong, only to find out that things actually could get better. So hold on to that mindset. Listen to Dr. Greg, go back and hear the old recordings and ask yourself, is this a solution for me? And then ask yourself, have I really tried this all the way? Have I given this a fair shake? But don't give up and know that there are answers out there. Just keep on giving yourself that chance.
Love it. Thank you. Sage advice. Everybody, this is What the Health. We are bringing you the information. Please, if you like the show, think of 2 people in your lives and share this one with them. That is how we get the message out. It is word of mouth. This isn't coming from the top down in mainstream media on 80% of people by changing the diet and the concentration of iodine their thyroids will improve. So, this is big information. He shared so much great information. If you like the show as well, get out there and give us a 5-star review and write what you learned and share it with people. That's how we get the message out. That is why I created this platform. And What the Health. We are here Tuesdays from 2 to 3 p.m. Pacific time on the Contact Radio Network. We'll see you next week.